Welcome to VetParent Podcast, the podcast made by veterinarians with the help of AI. Here you will find everything you need to know about your furry friend. In today's episode, we will be talking about
bringing a new kitten home is this incredible mix of pure delight and, let's be honest, pure unadulterated panic.
Oh, absolutely.
You want to do everything right. You've got the checklist, the toys, the tiny little scratching post, but the information just comes at you like a fire hose.
It really does.
So our mission today is to, cut through that noise.
Exactly. We see new owners in the clinic with these massive, well-meaning checklists, but what they really need is the framework, the scientific, biological why behind all the rules.
Right.
We're moving you from reactive care, dealing with a crisis after it happens, to proactive health that ensures a stable, happy cat for the next 2 decades.
And the very first thing we need to address isn't even medical, it's psychological.
It is.
The biggest mistake new owners make is panicking when that little fluff ball hides behind the couch for 48 hours. They think they've broken the kitten.
That anxiety is so common, and it's completely unnecessary. It's why we teach every new owner this vital expectation management tool. We call it the 3-3-3 rule.
The 3-3-3 rule. Okay, I'm intrigued. Let's unpack this. What are the 3 stages?
So the first 3 days are all about decompression. The kitten is overwhelmed. They're probably hiding, maybe not eating much.
They're just adjusting.
They are just adjusting to a massive environmental shock, so, don't interrupt them. Then the next 3 weeks are when they start to learn your routine, they start exploring, and begin that initial bond with you.
Okay, makes sense.
And finally, it takes about 3 months for them to truly feel at home, to really establish their territory, and fully integrate into your life.
So if you know to expect 3 days of shyness, you don't call the emergency vet because you think the kitten hates you.
Precisely.
That immediately calms things down.
It does. And that framework, just understanding that transition period, it grounds our entire professional approach. We view the move to a domestic environment not just as cute, but as a critical period that requires, optimizing their habitat and understanding their biology.
So if we translate those slightly academic concepts like, developmental ethology and environmental optimization, if we translate that into practical terms for the listener, what are we really talking about?
We're talking about creating a home that speaks to their unique needs as a developing feline, minimizing stress, maximizing their security, and avoiding some really critical biological hazards.
And this is where your local vet comes in.
Your local veterinarian is your absolute best partner in this journey, ensuring we apply rigorous preventative protocols, starting with that all-important first checkup.
Right. Let's jump into segment 1, safety and home preparation. We all know we need the secure carrier and the bowls, but preparing the environment is really more about minimizing stress and preventing those accidental crises.
It is.
So let's start with the scary stuff, the things that can actually accidentally kill a kitten.
This is where understanding the biological why truly saves lives. Kittens are incredibly vulnerable to household toxins, and here's the key reason. They lack a necessary enzyme. It's called glucuronoltransferase in their liver.
Glucuronol. Okay, what does that do?
It's the enzyme they need to detoxify chemicals.
So their internal processing factory is still under construction.
That's a perfect analogy. Think of the kitten's liver as a deficient chemical factory. Because they can't metabolize these compounds effectively, everything from medications to certain plants is magnified in their tiny bodies.
Wow, so they can't process common household items that a dog or even a human might tolerate just fine. What are the 911 emergencies that require immediate intervention?
First on the list, always, are the true lilies. We are talking specifically about the Lilium and Hemeroclus species.
Okay.
Ingestion, even if they just lick the pollen off their fur, causes acute renal failure.
Kidney failure.
Acute kidney failure. This is a true life-threatening veterinary emergency, and you need to get that kitten to a hospital immediately.
That is so critical. It's so easy to mistake a truly toxic lily for one that isn't. So the rule is just keep them out of the house entirely.
You must. Secondly, acetaminophen, or Tylenol. It causes this terrifying condition called methemoglobinemia.
Okay, big word. What does that mean in practice?
It means the cat's red blood cells cannot carry oxygen effectively. So clinically, if this happens, you'll see a blue-brown discoloration of the gums, maybe some facial swelling. It's an emergency.
And what about essential oils? People love diffusers.
Essential oils are a huge problem because they contain phenols. Oils like tea tree, peppermint, or cinnamon can quickly cause liver failure. This often happens from owners, applying them topically for some perceived home remedy. Please don't do that.
And beyond chemicals, what are the non-chemical hazards we should be looking for?
The other major one is linear foreign bodies.
You mean like string?
Things like string, yarn, dental floss, tinsel. If they swallow it, it doesn't pass smoothly. It can actually saw through the intestines as the gut tries to move it along, causing severe, life-threatening perforation.
Horrifying.
And we also have to mention common human meds, things like NSAIDs, so ibuprofen or naproxen and antidepressants. They're very common in homes and extremely toxic to felines.
Understanding that kitten biology helps you prioritize cleaning up. Now, let's talk about optimizing the environment itself, starting with something simple. The food bowl. Tell us about whisker stress.
Whiskers are not just cute.
Yeah.
No. They are highly sensitive, tactile organs. They're like high-tech sensors. So when a kitten eats or drinks out of a deep, narrow bowl, the sides are constantly brushing against those whiskers.
And that's annoying for them.
It causes sensory overload, it's irritating, and it can lead to them knocking food out or seeming to be fussy eaters. It's just too much sensory information all at once.
That really reframes how I think about a simple food bowl. So the actionable advice is wide and shallow.
Absolutely. Ditch the deep bowls, use flat plates or wide, shallow bowls instead.
Easy enough.
The other huge environmental point is litter box placement, which ties directly to their security.
Right. So many people hide the box in a closet or a deep corner for aesthetic reasons.
And that seems intuitive. You want to give them privacy.
But that privacy equals danger for a cat.
It does. We need to remember that the cat is a mesopredator. It's both a hunter and potential prey. A litter box in a corner is what we call a single exit trap.
A single exit trap.
Exactly. When they're using the bathroom, they are in a vulnerable position. If they only have one way out, they feel trapped and insecure. And we aren't just thinking about a hostile dog, we're thinking about the feeling of being trapped when your vacuum cleaner suddenly rounds the corner.
They need an escape route. So place boxes in areas with multiple ways out.
Yeah.
Now, what about the number of boxes? The famous N+1 rule.
Yes. The rule is N+1. That means one more box than the number of cats you have.
So one cat, two boxes.
One cat, two boxes, in separate, physically dispersed locations. This is crucial for resource separation and preventing any kind of territorial guarding.
But what if someone lives in a small apartment? How do we balance that rule with, the reality of limited space?
That's a great question. You don't need the boxes right next to each other. The key is dispersal. You just want choice and distance. One box in the bathroom, another one in a quiet spare room. The goal is providing enough choice and security that the cat never feels the need to resort to inappropriate elimination.
That discussion on dispersal and choice transitions perfectly into segment 2 because the same biological principles apply to how we feed them. We're moving beyond just scooping food into a bowl.
Absolutely. The foundational biological truth is that the cat is an obligate carnivore. They are biologically hardwired to eat meat, period.
And unlike dogs or humans, they can't make certain nutrients themselves.
Correct. They cannot synthesize two absolutely vital nutrients: taurine, which is essential for heart and eye health, and arginine, which is vital for detoxifying ammonia in the body.
So they have to eat animal protein to survive, or they face life-threatening deficiencies.
Exactly. A vegetarian diet, or even one that's just too low in animal protein, will lead to severe life-threatening consequences like cardiomyopathy or liver failure. The need for animal protein is non-negotiable.
And this relates directly to hydration, right? We often hear that cats are just bad drinkers. Why is that?
They have a very low thirst drive. It's because they evolved from desert ancestors who got almost all of their water from their prey, which is naturally about 75% moisture.
And dry kibble is what, like 10%?
Dry kibble is only about 6 to 10% moisture.
That sounds like a recipe for chronic mild dehydration, which is often cited as a cause of major health issues later on.
It is. This is why wet food, which is 75 to 80% moisture, is a primary long-term medical strategy.
Because it's not just a treat.
No, it's medicine. Providing wet food helps prevent chronic dehydration, it supports long-term kidney health, and helps prevent issues like FLUTD or feline lower urinary tract disease. It keeps the whole urinary tract flushed.
That's a powerful argument for investing in wet food. Now, how do we avoid the other big health issue? Obesity. I'm sure people are tempted to just leave the kibble bowl full.
We have to bust the myth of free feeding. or ad libitum. Leaving food out all day is a major driver of obesity. Wild cats eat 8 to 16 small, separate meals throughout the day.
Wow, 8 to 16.
Yes. So we need to mimic that. Divide their daily ration into multiple small meals, ideally 5 or more, and use food puzzles to engage their natural hunting drive. It gives them crucial mental stimulation.
That ties physical health right back to their behavioral health. Okay, let's move on to immunology. Vaccinations feel like the most complex part of the checklist for new owners.
They can be because we have to navigate this delicate window of susceptibility.
A window of susceptibility, what's that?
When a kitten is born, it gets maternal antibodies, or MDA, from its mother's milk. These are fantastic, providing passive protection, but they interfere with vaccines, they neutralize them.
So the mom's protection blocks the vaccine's protection from taking hold.
For a time, yes. As the MDA wears off, there's a vulnerable period, the window of susceptibility where the kitten is temporarily unprotected.
So the staggered vaccine series is designed to hit that sweet spot right when those maternal antibodies have faded, ensuring the vaccine actually works.
Exactly. The core vaccines protect against 3 main things: FPV, or feline panleukopenia, a severe GI illness, FHV1, which is feline herpes virus, and FCV, feline calicivirus, which causes mouth ulcers and respiratory issues, plus rabies, of course.
And there's a critical updated protocol for new owners, correct?
Yes. The 2024 global recommendation from WSAVID now recommends a booster dose at or after 26 weeks, so 6 months of age, rather than waiting until the 1-year mark.
Why the change?
It's a failsafe. It's to ensure protection for those few kittens whose maternal antibodies might have lingered past 16 weeks and neutralized the earlier doses.
That is a critical update to discuss with your vet.
And we must treat FLV, feline leukemia virus, as a core vaccine for all kittens up to 1 year old, even indoor kittens.
Why even indoor only?
Because they are uniquely susceptible to progressive infection in that first year of life.
And before any shots, we test. What are the rules for FLV and FIV, feline immunodeficiency virus?
Every single kitten must be tested before vaccination. We need to wait about 30 days post-exposure for FLV to show it positive, and about 60 days for FIV.
Okay.
And, crucially, if you have a kitten whose mother was FIV positive, they might carry her antibodies without being infected themselves. Those kittens have to be retested after 6 months of age to know their true status.
And finally, on the medical front, sterilization. I know there's a consensus now around the 6x5 protocol. What's the clinical reason for moving that timeline up?
Well, sterilizing before the first heat cycle, which can happen as early as 4 months old, provides a massive 91% reduction in mammary cancer risk.
91%.
That's the primary health driver. And secondly, it prevents unwanted litters and stops major behavioral issues before they start, like roaming and territorial spraying.
And we can finally put to rest that old myth that sterilizing early stunts their growth.
Absolutely. The data is crystal clear. It does not stunt growth. It may cause a slight delay in the closure of their growth plates, which can sometimes result in a slightly taller cat, but it has no negative impact on their overall health. That massive cancer risk reduction far outweighs any other concern.
That is powerful clinical data. Let's jump into our last segment, the psychology of your new kitten. We've managed their physical health. Now we need to build trust and teach them how to exist happily in our human world.
This all hinges on understanding the socialization timeline. Now, while we recommend bringing them home between 8 and 12 weeks, the primary socialization window is actually shockingly brief.
How brief?
It's between 2 and 7 weeks of age. Sometimes it extends to 9.
That's it. That's the neurological window for acceptance.
That's it. Exposure to humans during this short time dictates their lifelong perception of us as a friendly species or as something to fear.
So once they're home, the focus shifts to
habituation, getting them used to your life. And the critical advice here is to use positive reinforcement and strictly avoid punishment, which instantly damages that human-animal bond and just increases fear.
Speaking of bond building, what is the fastest way to speak cat and tell them you're friendly without using any words?
That would be the slow blink.
The slow blink.
Direct, intense eye contact is a threat in the feline world. If you just stare at a cat, they assume you're a predator.
Right.
The slow blink is the physiological signal for, I am not a predator and I trust you. And when they slow blink back at you, they're reciprocating that trust. It's an immediate, powerful tool for positive interaction.
Okay, let's unpack this popular myth. Scruffing. Owners see the mother cat pick up the kittens by the back of the neck and think, oh, that's the natural way to handle them.
That is a myth we have to debunk aggressively. Scruffing causes intense fear, loss of control, and anxiety in kittens.
So why do mother cats do it?
When a mother cat does it, it triggers an infantile reflex in very young kittens that paralyzes them. But it is not a positive adult handling method. It should only be used in true medical emergencies for restraint, never for routine handling or discipline.
So we need modern, low-stress handling methods instead.
Absolutely. We recommend things like the cuddle wrap or just simple toweling for comfort and security. You have to build a bond of trust. That bond is instantly compromised by inducing intense fear via scruffing.
So what can we do proactively to make future vet visits less traumatic, both for the cat and, frankly, for our wallets, by avoiding expensive sedation?
This is crucial, and it's called micro-training.
Micro-training.
While the kitten is relaxed, maybe getting some treats, you gently handle specific areas, their paws for future nail trims, lift their lips for dental checks, touch their ears, for future medication.
So you're desensitizing them.
You are. Desensitizing them now ensures they are cooperative adults, and that saves hundreds of dollars in future sedation costs because they won't fight every necessary procedure.
And the dreaded carrier. The carrier appears, and suddenly the cat disappears into the house siding.
The carrier must become a permanent piece of furniture, not a trauma device that only appears when they're going to the vet.
So just leave it out all the time.
Leave it out. Build positive association by placing food, treats, and toys inside it every day. Practice short closures, then maybe short trips around the house. And during transport, always cover the carrier with a towel. It minimizes visual triggers and gives them that sense of security we talked about earlier.
Finally, let's talk practical steps. What if the listener has a resident cat at home? How do we introduce the new kitten without starting a turf war that lasts for years?
This requires a very systematic, gradual approach to prevent territorial aggression. First, you establish a sanctuary room.
Okay, a safe room for the kitten.
A separate, quiet room with all the kitten's resources. The two cats should not see each other at all yet. Next, you engage in scent swapping. You exchange their bedding, or you rub cloths on their cheeks and place them in the other cat's territory. This associates the other cat's smell with positive things, like treats. Then you move to gradual visual contact, using baby gates or cracked doors, always paired with high-value food or play.
So that positive association overcomes the initial territorial anxiety.
Precisely. If there's hissing or staring during supervised meetings, distract them immediately with toys or food to break the tension. Never punish the aggression. That just increases the anxiety in the room for everyone.
This has been such a deep dive. We've really transformed an overwhelming list of chores into, well, actionable knowledge driven by that core biological why. We covered safety and that unique liver vulnerability, health, and the non-negotiable obligate carnivore status, and psychology, focusing on that fleeting socialization window.
And it all connects. Long-term health really depends entirely on understanding these underlying mechanisms.
And remember the core message here.
Comprehensive preventative care is a partnership. Your local veterinarian is an indispensable resource for tailoring vaccine schedules, feeding plans, and behavior counseling specific to your new companion's environment and their unique developmental needs.
Absolutely. We leave you with one final thought, and it's rooted in the AAFP and ISFM's 5 pillars of a healthy feline environment. We talked about the N+1 litter box rule, one more box than the number of cats.
Right.
So, if the experts agree that a kitten needs not just a litter box, but choice and dispersal of resources, what does this tell you about their natural need for security and control in their environment? Think about how you can apply that pillar of separating key resources, making sure food, water, litter, and rest areas are all spaced out to every part of your home to truly minimize stress for your new companion. It's about giving them ownership over their new domain.